This lab will be on the pony specimen, so we're working on the thoracic limb still, and this will be on the attached right side. And we're working on a few of the intrinsic muscles of the forelimb, and then also working on the distal limb, the vessels and nerves, and then finishing off with the foot. For the start point in this lab, we're looking at the medial side of the right limb here, and you actually want to move just distally because we have to remove the rest of the skin on the distal limb here. So there shouldn't be much left, but you really just want to make a medial incision all the way down to the hoof, and then encircle the hoof around the coronet here, and then remove and discard that skin off of the distal limb. So take that off, and then you will look at some of these nerves and vessels and muscles in this area here. So we really want to start with the flexor muscles. So we're going to look at the superficial digital flexor muscle first. So here we're at the carpal canal where we had opened up that flexor retinaculum previously. And you want to just dig out some of those flexor tendons. So they actually are right inside the carpal canal. If you take a probe and you want to dig in there, you can actually pull them out. And here, this is the superficial digital flexor tendon. So you want to pull that out of the carpal canal and then trace it proximally. So here you can see that muscle belly, the actual muscle part of the superficial digital flexor tendon here. And here you see this extra little part, and that is the proximal check ligament. So you want to see that, but try not to cut through it as you move proximally following this, because that is actually supposed to be there. And so that's the proximal check ligament attaching to the tendon of superficial digital flexor. So the next one you want to look at, so you have to dig a little deeper into that carpal canal and pull out the deep digital flexor tendon. So here I've got the deep digital flexor tendon. It's very thick. So if you follow that proximally, you'll see that it has a lot of muscle bellies attached to it. So you kind of have all these different heads to this muscle, but you don't need to differentiate them, but just deep digital flexor muscle here. And then the tendon will run distally. So as you follow that down, you'll have another check ligament that you need to find. So as you pull out that tendon, so here I've got superficial digital flexor tendon here. This is deep digital flexor tendon. And you have this nice thick distal check ligament here. So very thick, much more prominent, and it will be more distal in the limb than the proximal. So deep is distal, deep digital flexor, distal, DD. So distal check ligament here, attached to deep digital flexor tendon. Proximal check ligament here, attached to superficial digital flexor tendon. So after you see the flexor tendons, then you want to work on the nerves and vessels on this medial side here. So here, we'll pull those out of the carpal canal again. And really you want to look at that medial palmar artery is what you want to follow. So follow the medial palmar artery, which we had identified before, and trace that distally down the limb. And you'll be transecting these a little bit later, these flexor tendons, but for right now, you just want to trace this artery and see where it branches. So here, you can see this branching point where the probe is, and then you have two sides to this artery. So you have a medial and a lateral palmar digital artery as it goes over the fetlock joint here. So here is a medial palmar artery that will branch into these two branches. So here we have a medial palmar digital artery, and then the other branch going to the lateral side over here will then be the lateral palmar digital artery. So a similar thing happens with the nerves. Here you have the nerve, the median nerve coming down, and you have it going into the carpal canal, so that would be medial palmar nerve at that point. And here on the nerve you have a communicating branch. So that actually goes across the caudal aspect of your flexor tendons. So here I'm just going to elevate the two sides of the nerve here. So you have a medial palmar nerve here. On the other side you have a lateral palmar nerve. And here in between you can see this nice communicating branch between the two. So that's just on the caudal aspect of those flexor tendons. So then here you have medial palmar digital down over the fetlock joint. medial palmar digital nerve. And on the other side, you would have a lateral palmar digital nerve on the other side here. But you have medial palmar nerve here over the carpus, and that actually, the median nerve up here before the carpus is giving off that lateral palmar nerve that goes to the other side. So that's right here. And you can trace that through if you have a nice specimen like this. But lateral palmar nerve is over there on the other side. Before we move on to the lateral side, I want to just point out a couple of things here on the medial side. One of them here in the carpus, so this is the carpal region here, is the medial collateral ligament of the carpus. So here you can see it going under this tendon, but it's this nice thick band here that's going over the carpus. So medial collateral ligament is right here. Then also on this medial side, I just want to point out one more time, we saw this before, but this is the flexor carpi radialis muscle. And that was that muscle that kind of obscured the view of our artery here and nerve. So we just want to make sure you recognize that that is the flexor carpi radialis muscle. And now we'll take a look at the lateral side. So now we're looking at a cranial and slightly lateral view here so that we can see a couple more muscles and follow their tendons distally into the foot here. So here we actually want to identify the common digital extensor muscle first. So this is the common digital extensor muscle, and then you want to trace its tendon all the way down across the carpus and distally in the limb. So the common digital extensor goes all the way down the digit and will become much wider here as it goes under the hoof. So here's the common digital extensor tendon. Follow that down. You also want to see this smaller muscle. So here, we'll elevate the tendon. This little tiny muscle belly here is the lateral digital extensor muscle right here. So then the tendon, the lateral digital extensor tendon, will go down the limb, so going distally, but it travels underneath the lateral collateral ligament of the carpus. So right here is the lateral collateral ligament with that tendon going underneath for the lateral digital extensor. And here you may see this variation in your pony as well, but there's a little piece of the common digital extensor that sometimes crosses over and joins the lateral digital extensor. Just so you know, that is normal, but it's not always seen. Just so you know that if you do see it, it is normal. But these two tendons don't join as they come down distally in the limb. However, when we do the hind limb, you'll see that they actually do join. So the similar structure here, join together and then continue distally, but here we have them retaining their two separate tendons. So lateral digital extensor, common digital extensor. So now we'll take a look at the caudal aspect to see a few of the other parts of the distal limb. Now we have more of a caudal view of the distal part of the forelimb here. So what you want to do on this portion of the dissection, you want to cut your flexor tendons. So you want to cut through both superficial and deep digital flexor tendons. And if possible, you want to do it just distal to this communicating branch between the palmar nerves, so that you're not cutting through that as you do this. So cut through your flexor tendons, and you're going to start reflecting them distally, pulling them out. And what we want you to see here, these are a little bit hard to see sometimes on the specimens, but this, where the probe is kind of underneath, this is the palmar annular ligament. So that's holding those tendons in place here over the sesamoid bones. So you want to cut through on one side. I usually do it on the medial side. So I just cut through one side in between the tendons and the sesamoid bones right here. And you're cutting that palmar annular ligament and then kind of just reflecting that off so that you can reflect these tendons and pull them down. So the palmar annular ligament here, and then the next one is the proximal digital annular ligament. So this one is a little bit harder to see, and it kind of makes almost an X shape where you have 4 little points of insertion, and it goes across these tendons. So if you can cut through it, again, I would say on the medial side here, just cut down, follow the tendons down, and you'll just reflect it off like that if possible, so that you can see it here. So here you can see this thin sheet is the proximal digital annular ligament. So that's been reflected. And then we also have a distal digital annular ligament, which can sometimes be really difficult to see. Here, I'll just put the probe underneath the very proximal edge of it here. So it kind of connects, it's a U shape that goes around like this, the distal digital annular ligament here. And so you don't have to cut through that one as much to reflect these tendons, but you may have to cut through it just a little bit on one side. So then you reflect your flexor tendons all the way down. And what you want to see then is the straight sesamoidean ligament here. And then you also have the oblique sesamoidean ligament. So here, if you lift up the straight sesamoidean, you can see the oblique is underneath. So it's just kind of this right here, oblique sesamoidean ligament and the straight sesamoidean ligament on the top. So you want to try and see those two things in this area, and then move a little bit proximally in the limb, and we're going to take a look at the interosseous tendon or suspensory ligament. Both names are fine. And so it's this on the very caudal aspect of the bones here. So right on the caudal side of the cannon bone, you'll actually just kind of get in between the bone and this, almost looks like just a tendinous muscle. So it is a muscle, but it looks like a tendon. And so this is the interosseous muscle, or the suspensory ligament is what it's called. So you want to find that on the caudal aspect of the cannon bone and uncover that, and then see that it branches around the sesamoids. So here you've got branching here, and it's branching around on both sides of the sesamoids and inserting on them. And then we have to look at what's called the extensor branches of the suspensory ligament. So here you can see on the medial side you have it inserting here, but then sending this little tendon here. That's called the extensor branch of the suspensory ligament. So extensor branch here, and there's also one on the other side. So we'll move to a cranial view so I can show you both of them at the same time. So here's a cranial view of the distal limb, and I just want to point out the extensor branches of the suspensory ligament. So here the probe is elevating one and the forceps is elevating the other, but they wrap around and come up to the common digital extensor tendon here and join with that. So here you have the extensor branches on either side.